This is an abstract from an article out of Food Chemistry, an extremely boring journal. You open up this journal any month, and it's just numbers, just lines and numbers. Only really serious academics about chemistry of food and pollution in food are interested in this. In this particular issue, April 16, 2012, they came out and said a little over a year ago, commercially available baby foods, they're talking about Gerber, Similac, Enfamil, one that you're very familiar with. Commercially available baby foods may contain less than 20% of the recommended levels of many minerals and vitamins that babies require, less than 20%. Dog food has 100%. Laboratory rat food has 100%. Chicken food has 100%. Sheep, pig, horse, cow food has 100%. Laboratory rat food has 100%. Because we spend billions of dollars making sure every mouthful that those animals take is nutritionally perfect. We have no health insurance for them. Now, the medical system has legislated themselves into a protected monopoly since 1914. It's almost 100 years now. The story of this is in this new book coming out. They legislated themselves into being a protected monopoly. They're self-policing. They legislated all of their competition into being quacks. Everybody knows anybody who's not an MD is a quack because legislation says so. Who paid for that legislation? The medical doctors. They didn't earn their place at the pinnacle of all healers in America by earning it, by being the best healers in America. They did it by legislation. And you have suffered the consequences beyond belief. You have suffered the consequences beyond belief. Because they have no competition. Nobody can say, well, I can cure your rheumatoid arthritis in 2 weeks. It'll cost you $300. Because you have insurance. Medical doctors say, well, that guy's a quack. Insurance will pay for you to be treated for 25 years. And I, the doctor, will make $750,000 because insurance will pay. But I can cure you in 2 weeks for $300. Well, I'm sorry, insurance will pay for 25 years of treatment for $750,000. So I'm going with the insurance. Because you've been told that insurance is the best way. Of course, you may remember all these movies, Grease, and all these teenage movies back in the day, right? Think about it. Especially you men, think about it. When you were 16 years old and you had your first car and your first date, the goal, of course, not to get into your girlfriend's mind. Well, your doctor, when he graduates medical school, his first goal is to get into your insurance policy. The same fervor that men did back in the 60, 70 years ago, their first date in their first car to get into their girlfriend's brain, right? Well, your doctor wants to get into your insurance policy. You walk into the office and say, well, how are you going to pay? I mean, you don't even know who I am yet.